Well, a little bit more. I know you're all ready to go out and enjoy the Bay Area weather here, and it's the last session. So just bear with me. I'm just going to sort of like recap. We have learned so much today from our esteemed speakers here. Love all the sessions so far I've attended. I want to thank Santa Clara County Getting to Zero team here for doing an amazing work. Thank you. People were thinking to clap or not, but you have done an amazing work bringing everybody together, and definitely the statewide symposium for bringing the esteemed speakers from all across the state for sharing the expertise on the topic. So I do not have any financial disclosure. And after this session, we are bringing everything together at the end as we have learned from so many speakers here. And ultimately, the learning objective today is to get back to the organizations, to our organization, and see what change can we make, right? So what I am gonna share with my slides is the importance of the collaborative teamwork, like how we as a Bay Area Community Health, we work together with different organizations to make sure that patients are getting the optimum care, especially for our people living with HIV 50+. A little bit about myself. I'm the internal medicine physician and currently Chief Medical Officer at Bay Area Community Health, which is a FQHC, Federally Qualified Healthcare Program. I'm also addiction medicine trained. So Dr. Puri, wherever you are and whatever you were talking, it was getting close to my heart here, especially for the low barrier harm reduction program that I manage as a director. And I believe I know Dr. Abon mentioned a little bit about the new clinicians coming up and how they are trained. So we definitely feel like we have to build our clinical workforce. So in that way, we are part of ATA Still University, a hometown scholars program in which we motivate the community members to go to the healthcare and the physician assistant school. That's something that we do at the Bay Area Community Health. I also volunteer my time as the Alameda County Public Health Commissioner and Board of Director for a residential substance use, drug use rehab facility in Alameda County. So Bay Area Community Health, as Sean mentioned, we have 29 different sites. We also have 13 different mobile clinics, and we believe in providing the accessible services to the underserved clients, Medicaid, Medicare population in this area. And this is on the right-hand side, on the left-hand side, you see the map of the Bay Area here. We serve in 2 different counties, Alameda and Santa Clara County, and especially the folks which are out of Bay Area here, including our organizers, some of the organizers. I hope you get some time to visit the Bay Area after this conference and enjoy the weather here. And on the right-hand side, you see the annual report for Bay Area Community Health. The main thing that I want to emphasize is we have served 66,000 patients, and the majority of the patients, they speak or they belong to a different ethnicity, Hispanic. They identify as Hispanic or Latino ethnicity, and we serve a comprehensive services. So it's not just about the medical care. Like in the medical school, right? One of the speaker mentioned that we're not trained in geriatric services, I think you mentioned. So it's not just about the medicines, right? It's about the comprehensive care for our patient. That includes, I met some of the counselors here, so behavioral health. We also provide optometry, dental services, low barrier harm reduction program or the MAT program. We also have a robust HIV program and the gender affirming care program that we call it as a transvision program. So it's sort of like providing the services under one roof so that we can have an integrated model of like communication for the patient care. So specifically, I want to share the partnership with the County Public Health Department. And if you are, wherever you are in the county, this is going to be a very essential process for you to make a significant impact for your patient population. Working alone or working in silos never helps. So we are very, very grateful to be part of the county. We work both Alameda County Public Health, but also with Santa Clara Public Health Department, and have received several funding opportunities as well from the department. And one thing I want to emphasize, and why I put only these 5 here, but mainly I wanted to give a sample, right? Like, it's not about just the medical care. I mean, as a provider, as an MD doctor, I can prescribe medication, but if patient does not have a stable housing, or they're unhoused individuals, it's a problem. So having that some type of funding where you can connect patients with the housing is also very important. And then MAT, which is medication-assisted treatment, which is close and near and dear to my heart, which is also very important, especially in the high-risk population that we are talking about today. And one thing I want to, again, all of us have gone through these sessions today. So we have talked about, and I really appreciate how the organizers have arranged the topics today. It's not just about aging. It's not just about the psychological health, right? It's all about combination. So this is one of the definition. I wanted everybody to look at that as well. This is from CDC that says mental health or behavioral health does not just mean depression, anxiety. It also includes emotional and social well-being. So mental health affects how people think, feel, and act. It also helps to determine how we handle stress, relate to others, and make healthy choices. It's important at every stage of the life. I know we're talking mainly about the elderly patients or the aging population here, which I will show you in a couple more slides that how important it is, especially in this population. And not to spend much of the time because we have gone through all of that, but just to recap, depression is one of the most common comorbidities that we see among adult HIV positive individuals. But the main thing that, again, I want to emphasize is this is one of the studies have shown that depression in the HIV positive individuals is 2 to 3 times higher than in HIV negative individuals. So this is more about psychological, right? When we talk about mental health, we think about PTSD, depression, anxiety, and other things we talked about today. But there is social and emotional health, which is equally important. And we talked about stigmas, we talked about discrimination, we talked about the aging issues. And I want all of us to think about that as a holistic approach of like how we can make as together a difference and improve the mental health or the well-being for people living with HIV, especially the aging population. Again, there is a lot of data. I don't think I need to repeat that again, the things here. But one important thing, again, we talked about this and there was a fact sheet also, you might have seen it. But in 2021, as per California Department of Public Health, 56% of people living with HIV were age 50 or more. More than half, majority of the people. And in 2021, 17% of newly diagnosed patients were age 50 or more. So we have to do something. We have to come up with, change our perspective, and we have to come up with more of the, and this is a not so much studied subject, right? We don't have so many things. And we are today, through this symposium, trying to build a program so that the new clinicians that will come in, they will have some background, some foundation, and does not have to go through all of these unknown factors. This important slide I wanted to share because you can see the main thing is that a lot of time we don't screen or we don't ask questions because we think it's not relevant, right? So this is a case in which 45% of the patients only were recognized for depression, 18% received any treatment, 7% received adequate treatment, and only 5% of patients suffering from depression, people living with HIV, received remission. A lot of work to do. And because of the untreated mental health condition, I mean, that's no-brainer, right? If people are patient is depressed, there's a decreased initiation of therapy, decreased medication adherence, lower rates of viral suppression causing increased opportunistic infections. So just to recap here, again, this is not my last slide, so there's more to come, but we all know mental well-being includes social, emotional, and psychological well-being. There is an increased prevalence in people living with HIV, especially 50+. Several of these are undiagnosed, untreated, and it leads to poor outcomes. So what do we do? So one of the slide, or the next slide that I'm going to show you, that's the slide that I always go when I'm like, okay, where is the foundation? Like, where do we have to start? And this, I love this slide. This is a framework of 6 pillars by CDC. This was created specifically for SDOH, but it can be equally relevant to our topic here. So what it says is, we have to look at the data, we have to do the evaluation, build the partnerships or collaboration, community engagement, infrastructure, and policy, law, and funding. So if we adopt the same thing for our work here, what do we have to do, right? Awareness, that's what we're doing here, right? Some of the people flew from different parts of the state today to talk about this. We are bringing the awareness of the things which are needed to be done for mental well-being. Screening, resources, networking, funding, and then feedback and community engagement. So I'm going to share some real examples here, like what are we doing at Bay Area Community Health in collaboration with Santa Clara County. So I know, again, we talked a lot about PHQ-2, 9. There are several screening tools here. Some of you might recognize some of them, but this is sort of like not even the comprehensive list. This is just half of the list of the screening. So the questions are, it's hard to remember to complete all of them, right? And again, I'm looking from Bay Area Community Health, like a clinic. Patient is going to the clinic. Who will do all these tests? Who has time to do all these tests? Do we have time for a provider, HIV provider to do it? Or do we have time for, how do we do it, right? So there are a lot of questions. And I wanted to show this is what currently, this is for a test patient. Currently we use a software electronic health record called Epic. And this is how our templates look like. And as you can see, they're focusing mainly on the viral load, the labs, ARTs, is the patient taking medications or not? This is all it is. This is what we have been doing for a long time. So what we are doing now is, and thanks to my team here, our HIV director and the ID doc, we have created an updated comprehensive intake. And some things to focus is we are looking at the care team, right? This is the one thing I want to share. It's not just one person who can make a difference. It takes a whole village to make a difference. So care team is very important here, and it shows up like who is the part of the care team for this patient taking care. We have cognitive assessment. We talked about the dementia scale and MOCA, depression screening, GAD, functional ability, fall screening, very, very important, vision, hearing, SDOH, prepare tool, that's the one that we use, education, immunizations, and other things. So going to the care team model, this is what currently, or in the past we have been using. We say we are patient-centered medical home, and patient is in the middle. It's a collaboration, right? Primary care physician, behavioral health providers, outreach, pharmacist, like another amazing team is sitting here from Pace Clinic. They can all relate to that. So this is a team, and we do not have everything done in one visit. What the technology does with the module that I showed you, we do it in different visits. We do the telemedicine, like a phone appointment for patient, collect some of the data from that. But when the provider pulls that data together, everything is in one place so they can make informed decision or make proper referral for that particular patient. But going further, the next step that we did is made it an extended care team model, because we know with the limited resources, with the limited bandwidth, we cannot do everything. And we all have to realize this, and we all have to collaborate together. So we have partnered, there's a website called findhelp.org. Through that, we connect patient to different resources like food pantry, and we connect with health plans to get some incentives or even transportation vouchers for our patients. Aboard is another health services housing agency where we connect our unhoused clients. We work with definitely the public health department, their homeless program, and different hospitals and specialists. As you remember the CDC framework that I shared, the last two things was about collaboration and data collection is also very important, because if we don't have the data to share with the funders or with the advocacy at the state level or the national level, our work is not gonna be, it cannot be taken to another level. So we need that data. So data collection is gonna be very, very important, and collaboration. But the last and the most important thing is the feedback. And it's not just the consumer feedback, which is very important. I know there was a presentation in the morning, which was wonderful. Consumer engagement group, getting the feedback from the patient is important, but feedback from the staff, those case managers, the outreach workers who are working with patient, getting to know from them if the things are working well or not. It's gonna be very important for us. And maybe we can present how the things are going in the next couple of years. So in short, and again, this is not my last slide, is the conclusion that there is a higher number of aging population, people living with HIV. We all know that. This is a fact, and this is coming. This is already here, right? It's gonna get increased number of people, 50 plus, that we will be seeing. We need the collaboration, co-location, care team model, getting the feedback from patient is all very important. So I'm coming to my next, the slide that I'm very excited about is not this one. This is not my last slide. This is my references here. But this is a slide that I'm gonna come up with, and I would like all of you to open up your camera, and here you go. This is what I was excited about, because I want all of you to take a look at this. And I love the technology. This is the word cloud. So if a lot of people put one response, then it's gonna be more larger and greener and bigger, as we have seen before with other speakers. But what actions, what collaborations do you or your organization plan to take to help address mental health among older adults with HIV? What have you learned throughout today, or even before, with your knowledge and experience? And what is one thing you feel like you are gonna go back and talk to your director, talk to your supervisor, talk to your colleagues, and make a difference? And believe me, even a single thing, simple thing you do will make a difference. So be more open with harm reduction clients, absolutely. Promoting support, listen, very important. Social, community events, comprehensive care, MOCA for all, train more aging services, support group for 50 plus. Lot of suggestions coming up. Please keep coming, keep thinking, and we don't have to stop here. You go home, you go back to your organization, talk to your colleagues, brainstorm. I am very, very positive a change is gonna come from all of you here, and we're all together gonna make a greater impact in taking care of this population who has been gone through so much of stigma, discrimination. There was an epidemic in the past, right? We have gone through that, but now we are seeing increased numbers in women in 50 plus, and we all have to make a difference here. Thank you, everyone.
Thank you.